Hello, I am excited to be here. I was thinking this morning as I was doing a little meditation and getting ready for this webinar, and I was thinking it has been 15 years since Dr. Larson and I started working on auriculotherapy together. It was 15 years ago. I was fresh out of school and took this new position as an acupuncture research analyst. And my first assignment was to go in and dig deep and find everything I could about auriculotherapy. Look at all the different authors, all the different points, all the different combinations, how everyone was doing it. I had no idea that time of my life would progress and change so dramatically. But it wasn't a change. It was a build upon build upon build. So I'm super excited to share with you today where I'm at now with auriculotherapy, how I'm utilizing it in my clinic, and also in my life, and how this can be used in everyone's life randomly. It's such a good resource. Shall I share my screen now? Are we ready to jump
Yeah,
in?
let's do it.
Okay. So we are going to share, and I'm going to push play. There you go. Am I good? Are we seeing everything the way we're supposed to, Dr. Larson?
Yeah, I see your welcome screen. Looks great.
Okay. So I would like to thank you for being here with me today. I am Dr. Kimberly Thompson. I live in Meridian, Idaho, and I have been using auriculotherapy for nearly 20 years. And so I was just sharing that this journey started on my research for auriculotherapy 15 years ago. You go back in time, and it was my time in college that I was utilizing auriculotherapy. And honestly, it was my time in college, this little tiny bit that I knew and understand about auriculotherapy is what was it was the pivot and the platform for what came next. And auriculotherapy has been a game changer in my life and in my practice. And I would like to share with you today how it can be a game changer for you as well. Let's see. So we're going to talk about what auriculotherapy is. And if you can imagine, the ear on the body is like a micro mini map. Before I was an acupuncturist, I was a massage therapist, and I did a lot of reflexology on the feet, and the feet was a map to what was happening throughout the body. The ear is similar to that. There are many different versions of how you can look at the ear, but the simplest is to just imagine a fetus curled up in the ear, and you can recognize different areas of the ear that are related to different areas of the body. It is a non-invasive approach to treatment. Of course, if you are an acupuncturist and you're using needles, that is one approach, but it is so much more than that. You can use gentle pressure. You could use laser. You can use electrical stimulation. There are many, many ways to stimulate the ear in order to get results. And what you can recognize with treatment is that you're able to stop pain. You can stop stress immediately. You can change the internal systems within the body by treating the ear. The reason this works is because it regulates the nervous system. There is the vagus nerve goes right through the ear, and the vagus nerve connects us to our brain and then to the internal organs of our body. And the ear seems to be this pivotal spot that allows us access to both. As far as widespread applications, you can treat almost any condition by treating the ear, some aspect to any condition. You can treat chronic pain, digestive issues, stress, insomnia, emotions. Love to treat emotions on the ear. And it's not just it's not like a palm reader type of situation. When you're dealing with the ear, there's lots of information that comes through the ear, but it's all science-based. And there has been tons of clinical science data in relation to the ear. And that is why it is so popular. Science knows it. We know it. You'll know it as you experience the power of auriculotherapy. It's also versatile. Wherever you go, you are always going to have your ear with you. It's not going to be, oh, I forgot what I needed. I forgot my medication. I forgot my pills. I forgot my pain cream. No, you always have the ear with you. And what I love about the ear in relation to the foot, if you were always with me, you couldn't necessarily take off your shoe, or I wouldn't want you to take off your shoe and me be able to touch your foot all of the time, but your ear is always available. So super easy. And as far as self-care, some of the things that I'm going to teach you today, you literally can change the internal systems of your body by knowing a few key points and how to regulate your body by utilizing points on the ear. So the question is, who is auricular therapy for? And I want to say it is for anyone. It is for anyone who is interested. It is for my daughters who are not acupuncturists, who are not even massage therapists. It's for my daughters who want to work on their family. It is for beginners. It is for people who are curious. If you are a massage therapist and you want to do better for your client who's laying on the table and you know something about the ear, you're going to be able to get better results. If you are a person who loves to learn about the systems of the body and maybe you're that doTERRA person, or you're into frequency devices, anything that, if you're the kind of person who is always wanting to learn and know more about your body and how you can treat your body better, then this program is for you. Let's see. I'm going to go with the next slide. So the purpose of this webinar is to share practical strategies. I would like to teach you how to, if you knew how to treat the ear and you had the right resources in front of you, and you could start today by utilizing key points on the ear, that is what this webinar is about. I'm going to teach you how to treat points on the ear without tools. I'm going to teach you how to utilize a laser for treating the ear. And then I'm going to teach you about electrical currents in treating the ear and where science has taken us and some of the things that we know about the ear now. So I'm going to teach you each of these things. So it doesn't matter where you are on your journey, there's going to be something in this webinar that will benefit you. So, why auriculotherapy? One second here. So, like I said, it's a holistic, non-invasive tool, and it is simple and it's fast, and you can access any organ in the body through the ear. It's just knowing where to access the ear, knowing where that pressure point is. There are hundreds and hundreds of points on the ear, but no, and it can seem overwhelming, but if you have a way to know how to narrow in and how to get to the right spot, then you can make the changes that you need. I'm going to just open up something here really quick. There. Okay, never mind. I had something was on my screen blocking me. So again, it's simple, it's fast, it's effective. You don't have to use needles. You can utilize many tools and resources. I have, back in the day, I could use the tip of, not a tip of a pencil, but the eraser of a pencil, and I could utilize specific points on the ear. So I'm going to teach you what you can do yourself. So as far as science goes, I talked about the vagus nerve, and when I was in college, I took an entire weekend course about understanding how some very key points were used in the drug rehab programs across the world. And it was called the NADA protocol, NADA. And this was a program that was utilized by counselors, psychologists, people in the healthcare world. It was 4 very specific points that changed and regulated a person's system as they were going through detox. And it was so amazing and powerful to me to realize that you could teach an entire weekend about the changes you could make in someone's life by using 4 very specific points. And the one thing that I could tell you is those 4 points that were used fit into this green zone that I'm showing you on the ear. And this is the distribution of where the vagus nerve goes through the ear. So this was a very powerful opportunity for me to, at a very early stage in my career, to learn that a simple protocol could be so life-changing. This is my family. We have 9 children, my husband and I. And as I was going through college and I would show up to the family events, I was always studying. I had something that I was trying to learn, but I'd show up to the family events and people would say, "Oh, you do acupuncture. Could you do this? And could you do that? And could you do this? And could you do that?" And everybody wanted to be treated by me. And I learned very, very quickly that my best resource was an ear. And when I realized that I could change somebody's acid reflux, that I could change somebody's neck pain or their shoulder pain, I could help somebody who was feeling anxious by literally adding pressure points on the ear, then my life got a whole lot easier, because I didn't have to show up at every event and do full-on acupuncture treatments. I literally could make changes by the ear. And as I learned that, then I became empowered, and it helped me to become a better acupuncturist in my clinic. But it empowered me in the world. Wherever I went, I knew that I had resources for helping people. So as an auriculotherapist, everyone benefits from the resources that you have available to you. If you were if you are a massage therapist, you could benefit. I wish that I would have known or understand the power of the ear when I was a massage therapist. I did understand the massage of the ear, but that's as far as it went. But if I were able to put some pressure points to calm the nervous system or to help resolve pain, everything would have changed. And now I truly believe that no matter who you are and what phase of life that you are in, if you can add auriculotherapy to your life, you can make the job that you do better. So if I was a yoga instructor, I would absolutely be utilizing auriculotherapy. If I was an esthetician, I would create calming points to be able to supplement my program. If I was a chiropractor, I would be using the ear to supplement my program. And now, this picture of my daughters with their children, I'm always teaching them how they can better help their kids. And me as a grandmother, this is what I do. Wherever I go and whatever I do, I am able to share the power of auriculotherapy. So in this webinar, I'm going to teach you what I would consider good, better, and best. There are multiple options that you have available to you. And even if you're good, you're better, or you have the best approach, it doesn't matter, because I'm here to tell you all day long, I choose one of the options. It's not all, maybe good is where I started out, and maybe best is what I know at this point. But anytime within my day, within a treatment, even in my clinic, sometimes I use the good, sometimes I use the better, and sometimes I use the best. So, as I share these different approaches, realize that they are interchangeable. Um, you can use the power of auriculotherapy in all aspects of your life. If you're a doctor or an acupuncturist and you're using this in your clinic, be flexible. Sometimes the good approach is enough. Sometimes the better is just what you need. Sometimes you need to jump into the best approach. But if you are a lay person, you're not an acupuncturist, the 3 approaches that I'm going to teach you are going to help you in your confidence level with auriculotherapy and the things that you are able to treat. So I love this quote: good, better, best, never let it rest till your good is better and your better is best. In order to be good, the very first thing that you need is a resource. And before I share the resource that I'm going to tell you about, when I was in college, I wanted to be a good auriculotherapist. I was fascinated by auriculotherapy, and the way we did it back then, and now I'm talking like I'm old, way back when, but literally this was almost 20 years ago, we would stand around an ear chart and we would look and we would all talk together. I wonder if this point might be helpful, or this point might be helpful, or this point might be helpful. We had a few points that we used often because that was the best option that we had. And you didn't have a lot of time to go look things up, and you were learning so much about the bigger, deeper knowledge of traditional Chinese medicine. But we would just stand around a chart and we would hypothesize. We'd look at the chart, we'd walk into a treatment room, we'd try to remember where that point was, and then we would treat it. What I'm about to share with you has been life-changing for the entire acupuncture world. Students no longer have to wonder. They have resources, they have data at their fingertips, and I am thrilled and proud and honored to have worked with Dr. Larson to bring the acupuncture world to this point and to bring you to this point so that you have options. And here it is. It's called Auriculo360, and it's an ear map. So you can use Auriculo360 on an iPad or on your iPhone or even on your computer. And this is for the person who wants to have resources and they want to have them now, and they want the option to be able to compare and keep notes. You can actually keep notes in these programs. So whatever research you do, you can save the information within your program, and it will go across multiple devices. This Auriculo360 now has 290 points within it. Like, you could never keep that many points in your head, right? There are 212 protocols. It teaches 12 meridians on the ear. There are dental specific points. So no matter which direction you want to go, everything is at your fingertips, and you can open it up and you can find the points. So the first thing that you need in order to be good, better, or best is a resource. And Auriculo360 is the resource, and I'm going to share more. Once you have a resource, then you have many options. The simplest, most easy option for treating a point is to look at a map, decide what you want to treat, and then put a pellet on it. And the world of ear pellets has changed significantly in the last 20 years. You can now have, you can have the little Band-Aid pellet, which is Vicaria ear seeds. They stick to the point. When you press on the point, it actually creates the trigger of what you need to communicate through the vagus nerve from your brain and to the rest of your body. And Um, that simplicity has been around for a while, but we have grown. The whole world has grown. Now you can have little gold pellets, and you can put gold pellets on the ear. You can put diamond bling on the ear. Patients love that. Grandkids love that. It's a fun thing. I like to promote it in our clinic. I have seen at Valentine's Day, we'll have everybody who comes in, we're putting ear bling on their ear so that they can share the love. It's a great walking, your patient becomes a walking business card. I put ear bling on their ear and I hand them business cards when they leave, because everyone will ask about their ear therapy. But anyway, the point is, all you have to do, you have to have a map. You have to know where the point is. You have to have ear pellets or ear bling or ear gold. You have to have tweezers to peel those stickers off and put them in the ear. And you just place the pellet on the point that you want. You press the point with your finger and you feel better. I'm going to share a couple of stories with you on how I learned this along the way. And let's talk about shoulder pain, because this protocol here was probably the first protocol that I had memorized. Let me go back one slide. If basic points, if you're finding single points within your resource, your Auriculo 360, if you know single points and how to treat them, that's the first step. The next step is to explore with protocols. And I love pain protocols, but I especially love the shoulder pain protocol, because this shoulder pain protocol isn't just shoulder, like at the shoulder joint. It is the scapula. It is the upper shoulder. It connects to the neck. And honestly, I can have somebody who tells me, oh, my neck is hurting and it's right here and it goes into my shoulder. And I will put ear pellets. This is the whole protocol, but I've circled my favorite areas where I like to put the ear pellets. I will put ear pellets on those points, and I will give pressure. And then I will tell my patient, okay, move your neck again. And that's where the jaw drops. You get the jaw drop. Patients get so excited that, holy cow, you just changed their pain immediately. That protocol works with ear seeds. That protocol works with a laser. And I'm going to challenge you to memorize that area of the ear, know those points, because that protocol will save your life, especially if you're an acupuncturist and you show up at the family party and everybody wants to treat you. You want to know this protocol. Okay, I'm gonna move on. The next one that became a very favorite of mine was low back pain. Within your Auriculo 360, there are multiple protocols. If you typed in low back pain, if you typed in knee pain, if you typed in elbow pain, if you typed in jaw pain, there are multiple protocols within there. But I want to teach you a few things that you should know about pain so that you can get the best out of this treatment. And again, we are talking good. This is just to be good. You're going to use pellets. You're going to use pressure. So here are some tidbits that you should know. If their pain is on the right side, treat the right ear. If it's on the left side, treat the left ear. The points that I showed you, let's go back and look at that. If you see these points for the clavicle, the master shoulder, the upper limb, you're watching all these points. If you are treating the front of the ear, you are treating tendons, bones, and ligaments. And that is you're going to get results right there. But if you want to get better, you're still in the good zone, you want to get better results, if you will mirror that pellet on the back of the ear, and once you know that you've made a change on the front of the ear, if you'll mirror the pellet on the back of the ear and then push the ear again, you're going to get tremendous results, because the back of the ear is the muscle. I highly recommend treating both sides of the ear when you find the points that work. And all you have to do is squeeze as needed. Back to the family party, their neck pain, that, maybe the headache that's starting from the back of the neck and it's from the shoulders radiating up. You get those ear pellets on and it's all done. And then you tell them, when you feel the pain again, all you have to do is go back and press the ear and move your shoulder and move it around. And then the pain goes away again. It's genius. It's genius. It works. Patients love it. This is where I get the high five in my clinic. This is where I get my family that says, "Oh, Mom, you're the best." And I didn't have to do anything except for put pellets on their ear. So remember that when you are in your app, all you want to do is search for the place of pain. You could type in the word pain and you can get a lot of protocols that come up, but type in elbow, type knee, type foot, wherever the pain is, that protocol will come up. Okay, so I would recommend when you are becoming good with auriculotherapy that you start small. The shoulder pain protocol would be the one protocol that I would totally tell you to begin thinking about. But then you're gonna start thinking about individual points. You're gonna treat a few points at a time. Don't become overwhelmed by great big huge protocols. Understand that you can treat pain, you can treat stress, you can treat digestion, and all you have to know are a few key points. And these points are really powerful. I want to tell you a story about this protocol right here. It's Shenmen, point zero, and vagus nerve. Years ago, I wrote a blog post and there was a similar set of points. It was Shenmen, point zero, and sympathetic. And there was an acupuncturist who reached out to me and she's like, "Dr. Kimberly, I don't know what to do." I don't know if I was Dr. Kimberly at the time. It was probably just Kimberly, but she reached out and she said, "I did this thing. I'll never do it again, but I sold, what is it? It is called, it's one of those neighborhood things." Chime in, Adrian. Do you know what I'm talking about? It is where you sell. Pardon me?
No, I don't know what you're talking about. A neighborhood thing?
Okay. It's where you sell some coupon and you get a whole bunch of discounts for your product, and you might have, it's a neighborhood thing. I'm sorry. It'll come to me in a minute. Anyway, she had sold 600 acupuncture visits for like $30 a visit to bring all these patients in. And she got all this money, but now she had 600 patients and she didn't know what to do with them. So we talked about it and she had to get through it because she had already sold it. And
Hey, Dr. Kimberly, it was a Groupon. The chat.
Groupon, that's the word.
Yeah, the chat came to the rescue. About 20 people all said Groupon.
Groupon. I don't recommend selling a Groupon, but you know what? She turned that into a powerful learning opportunity. She researched her auriculotherapy points and she decided which points she would use to make incredible changes in the body. And she literally did ear treatment. She used needles, but she used Shenmen, point zero, and the sympathetic point. The sympathetic point is up under the ridge within the ear. And I'll tell you why I like the vagus point. But she used those points and she reached back to me later and she learned that she stopped pain. She changed emotions. She changed digestion. She helped people with insomnia. She was able to make so many changes in the body by simply treating those points that it was a reminder to her and even to myself, the power of just a few key points. So let me explain why I have moved on to Shenmen, point zero, and the vagus nerve. One is if I am, I like to teach people how to self-treat from home and give patients pellets. And it's a little bit harder to get to the sympathetic point, to get a pellet and to get it in there. But I started doing a little bit of research, and I was comparing why why you would choose vagus nerve versus sympathetic. And it's not that either of them are bad, and you could choose all four if you love them. But I realized the power of the vagus nerve as a treatment point in my clinic post COVID, for the inflammatory effects. And there's tons of research out there. There's a lot of research on sympathetic as well. But the research that I was doing and finding the effectiveness of vagus nerve, I came up with a point combination of Shen Men, point zero, and vagus nerve, and realized that this was so, so powerful. It's my go-to in the clinic, these 3 points, because I know that whatever I'm doing on the body, that I can supplement it. It's my go-to when somebody is in pain, or they have stress, or they have digestive issues. And I talk about this more. Let's see, do I talk about this more later, or do I want to talk about this now? I want to talk about this now. So in the, I'm giving you a download. I'm giving you something that I utilize in my clinic to help my patients to treat these 3 points. And I've created a download, and it has this picture of the points. I call it the vagus nerve transformation treatment, 3 powerful points for life-changing health. And I have learned that if my patients will self-treat these points from home, just like I'm teaching you, using this good, better, best philosophy, they tend to use the good philosophy where we're at right now. And it's Shen Men, point zero, and vagus nerve. And I have them press the nerve, or the points, 3 times a day to transform their vagus nerve while they're in a treatment plan. And in my research, I have found that this simple combination right here, you can change somebody's anxiety, their stress. You can help with PTSD. You can help somebody who has IBS symptoms. You can help with weight management. You can change somebody's blood pressure in the moment. So this protocol is really powerful. And so I'm sharing the handout that I give to my patients in my clinic, and you're going to find it. The link is going to be in the description. If you're live on the webinar, you'll find it.
I put the link in the chat too.
There's a link in the chat if you're live on the webinar. If you're watching this later, the link will be down in the description. I am sharing this with you. It's a 4-page handout. It shows the ear. It shows the point. It gives 25 benefits for stimulating the vagus nerve and how to do that through these points. And then I introduce some tools and resources that my patients can use. I actually sell the resources in my clinic for my patients. And anyway, I wanted to share that with you today so that you could utilize it in your clinic. So when you're starting small and you're using a few key points, this is going to be very helpful for you. You can memorize this immediately, and you can get results immediately. I'm going to do one more slide, and then I'm going to pause and check for questions, Dr. Larson. The next thing that I want to talk about are 10 more points that I think are points that you should begin memorizing. As you're adding more points and you're thinking about more points that you would like to utilize, literally, if you have these 10 points as a resource, of course, they're going to be on your app because you're going to have the resource available to you. When you get your app, here's what I recommend that you do. In your app, you can create protocols. And in my app, I made a protocol, and I called it 10 amazing points that you should memorize. And then I put each of these points in the ear, and I can open up that one protocol anytime that I want to. Let me just give you some ideas of how you could utilize these points in your everyday life whether you don't have to be an acupuncturist. I literally feel like if you have an ear with you and you know the right points to treat, that you have a traveling medicine chest and there are no pills in it, but you can make changes in the body. So Shenmen, I'm feeling anxious and I'm overwhelmed and I'm stressed. Shenmen, put a point on Shenmen and add pressure. Let's see, 0.0. Notice that 0.0 and the stomach are very close together. 0.0 is a reset button in your body. It is the center point of it is center point if you were on your physical body. It's kind of where your epigastric area is. It would be like your third chakra going up. 0.0 is you just need to reset. You're feeling out of whack. You're feeling like you got this sixth sense in your gut. 0.0 is for you. Vagus nerve. Vagus nerve is relaxation. If somebody just is trying to relax, what if you knew that vagus nerve and you're going to go do a meditation and you want to relax and you could treat your vagus nerve point and then go do a meditation. That point right there could be life-changing. The sympathetic point, it's that one that's up under the ridge. It's a powerful point. And when I teach you more tools that you could utilize for treating that point, it's a little easier, in my opinion, for treatment. But the sympathetic point, if somebody's having a meltdown, I have grandchildren. I have grandchildren who have meltdowns. I've had college kids who've had meltdowns. I have had that best friend who shows up at your house and they're having a meltdown. You want to understand that the sympathetic point can literally change the energetic environment in their body through a meltdown. The allergy point, this point is at the tip of the ear at the very top. If somebody is having an allergic reaction, that is a point that you want to be aware of. And how great to have this little piece that you could be of help to someone just because you know where it is. The kidney point is a favorite of mine. I treat the kidney in my clinic all of the time. But the way you want to think about the kidney point is to recharge your batteries. Think of somebody, adrenal fatigue. They've been burning the candles at both ends. They're exhausted. They're not taking enough time for themselves. They're aging prematurely because they're burning the candle at both ends. The kidney point could be very beneficial to them. And if you know that that's their problem, you could put that, you could utilize one of your ear seeds. You could put that sticker on their ear, and then you could send them a text in the middle of the day. Go press your ear. Go press your ear, friend. This is what you need. The liver point is a detoxifier. In Chinese medicine, we think of the liver for the emotion is frustration and anger. The liver, the liver's good if somebody has a hangover. The liver is good when you need to detox, when you got a lot going on. The liver is good for a cancer patient who's going through needs to detox after their chemotherapy. There are many, many good reasons for the liver point. This stomach point, which is right there by 0.0, is fantastic for digestion. I have treated that point and stopped somebody's acid reflux. And if you know where it is, it's so easy to remember where it is, and you can use it in the future. The next point I want to tell you is the endocrine point, and it's right down, right at the base of the ear, right underneath in the back of this little dip at the bottom of your ear. This balances hormones. What if you had an ear seed there and you could change the hormone balance in your body in the midst of a hot flash? I'm just saying, these points are so, so powerful. And literally, it's a walking medicine chest. And I hope they make you excited. They make me excited. I'm sure you can tell. I'm going to pause for a minute and see where we're at with questions before I move on to better. What you've learned so far is you've learned if you have a resource, you have a little bit of knowledge about some key points, you can make major changes in the body. Dr. Larson, do we have any questions I need to address right now?
Yeah. There's some in the Q&A, but first, there's some that got put in the chat too. Let me read you a few of those.
All right. You want me
We
to leave my screen up or should I?
Oh, you can leave it up. It's fine.
Okay.
We'll just jump through these. Let's see. My sister wants to know if this can cure tinnitus. Yvette said that.
Tinnitus, I will tell you, tinnitus, in my opinion, is very hard to treat. And that's why eventually, after patients have been to doctor after doctor after doctor, and they've tried all the things, and then they wind up in an acupuncture clinic. There is a protocol, I believe, in Auriculo 360 for tinnitus, which possibly could help you. Sometimes it's just the thing that, right, that's it's the magic. What you have to recognize is it's a great resource treating the ear where the tinnitus is. I mean, you're going to get closest to the tinnitus by treating the ear. So I do treat it. I do use the ear, but I also use body points. And in my experience, tinnitus has been a little bit trickier to treat. So that's my honest answer.
Great. Next, are there any contraindications to treating hip or knee pain with auricular therapy if the patient has a hip or knee replacement? That's Jared Adlington asking.
No contraindications at all. That's the beauty. It's an ear. Their ear will be even more effective for their treatment because their ear will reflect what's going on in their body. So it's beautiful.
Okay. And David asked, treat contralateral ear. Did you say later to do bilateral? So contralateral versus bilateral.
Sure. So let me get clear with that. If you are if you're treating pain in the body, I recommend treating the side of the body where the pain is. So if you're looking up a pain protocol, sciatic nerve or low back pain or knee pain, any pain condition, I would treat the side of the ear related. If you are treating these other points, these other 10 or the protocol that I recommended earlier for the 3 magic points, I really like treating bilaterally. If you didn't have time for bilateral, I would at least do one ear at one point and then the other ear the next time. But my preference, I like things to match. I like the continuity of both sides. I like the balance of both sides.
Okay, Yvette says, my sister is also having tremendous pain from carpal tunnel. What points can help?
Well, let's break that down. If you had carpal tunnel, first ask yourself, where's the pain? My pain is in the wrist, right? So I would start with a wrist pain protocol. Then if you dug a little deeper and you thought, okay, if somebody has carpal tunnel, it's likely related to something in their neck because the nerves from the neck come down through the shoulder and through the spine. I'd start with treating the wrist, and then you might utilize some points on the neck. And as I get deeper into this webinar, I'm going to teach you if some of those more difficult conditions, how you can tools that will allow you to become the best. And if you're not resolving the pain by just treating a pain protocol, you might have to dig deeper, and I'll teach you that.
Okay, and sorry, there's a bunch of these, so I'm just going to kind of rapid fire them at you. Let's see. Kim asked, do you treat both ears? And you kind of covered that already. Darlene said, thank you for the protocol. D. Davis says, are there lasting effects after stopping?
Lasting effects after stopping. Well, you're trying to bring the body back into homeostasis, and the body never stays perfectly homeostasis, right? You can have anything that trips you up. Your emotions can trip you up. Your diet, what you eat can trip you up. So it's sort of this space that you live in where you're creating balance. Are you going to be able to stop pain one time forever? we'll go to the shoulder pain. The shoulder pain, I can stop the pain and I can help those muscles relieve, but how did they get the shoulder pain to begin with? How did they live their life? How do they live on their computer? Or how do they clench their jaw? That's when maybe you have to dig deeper into emotions.
And Ian asks for points for dizziness and tinnitus. And I think it's probably worth mentioning that the quickest way to get points for anything, fill in the blank, whatever it is you're asking, the quickest way is to just look them up in Auriculo 360. You can search, you can look alphabetically. There are hundreds of protocols, hundreds of points in the software. And so hands down, that's going to be your best resource for that.
Absolutely.
Let's see. Lorna says, Dr. Kimberly, regarding your comment on blood pressure, high to low, etc., medicated low blood pressure, safe? I think the question is, can you treat someone who's taking taking blood pressure medication?
I have treated people. There's no contraindication for treating the ear, whether they're on medication. The ear is going to create is going to do what the body needs it to do. So I've taken people who in my clinic, I've taken people who couldn't have a procedure done because their blood pressure was too high. And so I would take them through a series of visits, and utilizing auriculotherapy and whatever else that I was doing, we were able to get their blood pressure managed so that then they could go and have their procedure.
Okay, and next, any restrictions on using Auriculo as a layperson from a liability standpoint? John asked that. And I would just jump in and say, as long as you're not doing invasive things, putting tacks in that break the skin, or potentially using electric stim, which may require healthcare licensing. But these pressure type things that Kimberly's been talking about in the good protocol, there's no issues there that I'm aware of. Kimberly?
And I would just add that every state is different. If you were hanging your shingle to say, I'm doing auriculotherapy, and you were charging people, you might have an issue for, you need a license to touch, whatever your licensure is in that area. But I will say, as a massage therapist and pressure points, it's pressure points on the ear, pressure points on the feet, pressure points on the body, that fits right in. Somebody who does facials, I'd like to be able to open the door for whoever has a license to touch in some way to begin utilizing the ear. But friends and family, I would say there's no problem.
Okay. Boy, there's lots of questions. They just keep coming in, and I don't mean to derail your presentation. Let me know if we need to start saving some of these for the end, Dr. Kimberly.
Well, you kind of know where my presentation's going. Maybe I will be, as you look ahead at some of those questions, do you think that I might be answering some of them as I go?
Some you will, and some are really specific. There's a lot of people asking about specific conditions or problems, and about whether it's effective or how to treat. And
okay, let's move on with the presentation, and I'll stay as long as people want afterwards. How's that?
Okay, great.
Sound like a plan?
Great.
All
Yeah.
right, so,
And we will get to all of them, folks. We just we want to get through Dr. Kimberly's material. So go ahead, please.
okay. So what I've taught you so far. I mean, you're going to be good, and everybody wants to be good at what they're doing, but you have really good resources right here, right now with these points. So what I'm going to share now is how to be better. So when good is no longer good enough, you become better. I love utilizing the laser in my clinic. So if you have a map and you have a laser, it's not a matter of finding, and I'm not saying that good, you have to drop good in order to move better. Now, better means you have both resources, right? But laser is fantastic for treating multiple points on the ear. You can, my grandchildren, Grammy, I have a tummy ache. You know, everybody wants a little more attention when they come to visit Grammy, right? I could literally I could put that little child's head in my lap. I can open up an app for stomach ache. I don't know if it's called stomach ache, but whatever it's called, digestive disorders. And I could take my laser and I could just scroll around in that little person's ear and I can treat them. One, I'm giving them so much love. Two, I'm using something that's really effective and scientifically proven to activate acupuncture pathways. And then I'm using a resource that has the clinically proven acupuncture points that will help that. So utilizing a laser is fantastic. I carry a laser with me in my purse wherever I go. It's super fast. It's super easy. All you have to do is know what point you want to treat. And you might have some of those memorized from the good version, right? Like the shoulder pain. You could be on an airplane and the person next to you's got shoulder pain or anxiety, and you might have a few points that you could literally make a change for them right then and there. I have done that. I have done that on airplanes. But I do it with my grandchildren when they're putting their head in my lap. And then can I just say, I have a husband who is very kind, but he is nowhere an auriculotherapist, nowhere an acupuncturist. But I can open an app and I can open the app up and I can put my right ear in his lap or face up. I can lay in his lap with my right ear face up. I can open my protocol and I could open a stress protocol. I could hand him a laser and I can make sure he's looking at the correct ear and he can find those points and I can just tell him 10 to 15 seconds on each point. And I can feel the changes in my body. It's that easy. I'm envisioning as I teach you this, that you're going to be able to teach your family. Wouldn't it be amazing if our kids could work on each other, if our family members could work on each other? We were able to work on friends. It could be that easy. And that's how easy it is with a laser. And it's not a matter of peeling them off and getting it in the ear and getting it in the right place. It's literally looking at a picture, putting the laser on the point and treating it. You can treat directly on the ear and you could move slightly away from the ear and fine tune that beam. I like to treat directly on the ear. And to clean the laser, you literally a cotton ball with a little bit of alcohol, a wipe swab, it cleans the laser. And don't shine it in anyone's eyes, just shine it in the ear. Beautiful, beautiful treatment. I would give a plug here for the Points app as well, because if you love treating the ear, then you could also treat points on the body. And once you have a laser, then you've got lots of resources available to you. Let's see. I'm going to share a story. This picture has to have been about 8 or 9 years ago. And I utilized the appetite control protocol in our app when I was doing a weight loss program for myself. And at that point in time, I was down 67 pounds, was super proud of myself. And people always say, oh, can acupuncture help with weight loss? Well, ear treatment can absolutely help with weight loss. It's not going to cause you to lose weight. You still have to do the work yourself. And I've taken that concept into my own clinic. We actually have a weight loss program in our clinic now. And I firmly believe that if you incorporate the power of auriculotherapy and the acupuncture pathways into a weight loss program, that you can get amazing results. So snap a picture of this little ear here if you're interested in using auriculotherapy for appetite control, but this is great for the laser. If you can treat these points. I recommend 10 to 15 seconds per point, and you're changing You're changing appetite, you're changing metabolism, and I don't know what more I can say about that, except for yes, it works. Still have to eat good though. I'm gonna move on. So
Hey, Dr. Kimberly, can I just chime in really quick?
Sure.
So there were a bunch of questions about lasers. You clearly hit a nerve. People said, "Hey, can I use any old laser? What kind of laser is that? Is that special laser, et cetera?" So,
Yeah, let's talk about the laser before we
well,
move
I'll
on.
just throw in, I don't want to derail you. I'm just going to throw in a really brief comment here. No, not all lasers are the same. You want a laser for auriculotherapy and for body points. You want a laser that has some kind of specific parameters to it. And the thing that's most effective and gentlest is a 635 nanometer. You want less than 5 milliwatts. You do not want a strong laser for the ear. We have a really great laser. There's the link that's down in the description where you can find out more information about that. But no, it's not just any old any old laser you can find. Sure, that's better than nothing, but getting the right sort of thing, which is surprisingly affordable, really easy to carry around. Like you said, you have it in your purse. So you can look into that. So back to you, Kimberly.
Okay. So when, as far as better goes, now that once you started with good, you've got your resource, you understand some points, you're using some single points. As you get better, branch out into full protocols. Like we said, Auriculo 360 has hundreds of protocols and lots of resources, and utilizing a laser is very easy to and effective, easy and effective to explore with protocols. ADHD, anxiety, the points within these protocols have been chosen based on research, chosen based on other doctors and how they're utilizing them to come up with effective protocols where these points can begin to use together. So I believe, if you're still sitting here in this webinar, that you're interested in auriculotherapy, obviously. And at some point in time, you will want to keep growing. You'll want to keep learning. You'll want to keep learning more. And never stop. That's me. I never stop learning, never stop it better when best is possible. And sometimes you need the best. And like when we talked about tinnitus that is hard to treat, or we talked about carpal tunnel, and it wasn't just the muscles at the wrist. We could maybe change some inflammation, but it had to do with some emotions, and it had to do what was happening in the spine. But as you're digging into becoming the best, it can be overwhelming. If you looked at a complete ear chart, there are hundreds and hundreds of ear points on one ear. And how do you know what to choose? And how do you know how to begin to put it together? How do you begin to create your own recipes for how you're treating and what you want to do? And this is where you step up to the next level. Once you have an ear map, if you add the Pointo Select, I'm going to just tell you a little bit of what we've learned even in my 20 years of working in the acupuncture field. So we have learned that acupuncture points are electrically active. Because they're electrically active points on the body, we are electricity. We have a way that we can measure and we can find where particular areas of the body are out of balance. And the ear is no different. You have the ability to have the patient hold a probe. So whoever's getting treated, they're holding a probe in their hand, and whoever's doing the treatment is using a device like the picture here. This is the Pointo Select. You're scanning the ear, and the device tells you which points on the ear are angry, which points are needy, which points that you need to treat. And you literally push a button and you add the correct frequency to balance that ear. So now you've noticed we started with knowing a few points, and we started with some pressure points, and we started with some laser. But if you're really wanting to dig in and understand more of how you can treat more difficult conditions, you have the ability to scan, find the point, and treat it. You can also, now you're doing a little more research, and oh, so-and-so taught me about this point, and so-and-so told me about this protocol. In your Auriculo 360, you can create protocols, you can add new points, you can add your notes, you can add everything. So now you're becoming the best. It's not hard. It's a matter of scanning and finding them. And then when you were asked, somebody was asking, if I just treat them, have I fixed the problem long term? This is how you're going to get better results longer, because the ear is going to tell you, the person who's treating, it's going to tell you what needs to be treated, and that makes you a little more effective in your treatment. The thing that is really exciting for you to recognize is that we also now know that different areas of the ear, if we treat with very specific frequencies in relation to those areas of the ear, that will get even better results. So when I taught you earlier about 10 amazing points, well, now we can look at those points and we know which zone they're in. And any of your protocols on your Auriculo 360, you can overlap with these colors to know what zone they're in. And then you're able to treat according to the correct frequency. I do have a chart. There we go. I've showed the frequencies on this picture right here, but it's right in your Auriculo 360, and there's training on how to utilize the Point-O Select. So I'm going to tell a real life story here, that this is a protocol that sometimes I think that you have to be better. I mean, you could just treat with laser, and you could just treat with a pellet, but to really get amazing results with this protocol, I have found that by utilizing the Point-O Select, scanning the area of the ear, this is a protocol for hemorrhoids. And those points, I circled the area that I think are hugely important when it comes down to stopping the pain. Finding that exact point that is needed and utilizing it with the right frequency, I have been able to help patients change hemorrhoids, their pain immediately. And then the beauty of that is I can find the point once I know it is the absolute exact right point, and I've treated it with the absolute exact right frequency. Then I can put a pellet on that point and send the patient home and allow them to continue to treat the point. And people who have been ready to go have surgery because hemorrhoids were so out of control, we've been able to make a change there. And it's not a super fun subject to talk about, but it's real, and it's real life, and it really works. So this is an example, in my opinion, on how when you want to become the best, knowing how to fine tune and find that exact frequency or that exact point so that you can treat it correctly. All righty. So I'm going to teach you how to get started. You came, you learned, I threw some great information at you. I've talked about good, better, and best. Here's what I recommend. I recommend you need a resource, and Auriculo 360 is your resource, and then decide which level that you want to be and what you want to do. The ear pellets are great for manual stimulation. The laser is fantastic for when you have multiple points and you're going to do a full sweep of the ear, and it's also helpful for when you're traveling and you're off in places and you have a laser with you for those points that you have memorized. Well, you don't really have to memorize a whole lot because you've got your resource. Everybody always has their resource with them, right? Because it's on your phone. So there's that. Um, and then once you have all of the pieces that you need and the resources available to you, then it's a matter of onward and upward. You can go and make changes if you are a grandmother like I am, or a mom, or you're a chiropractor who wants to add some level of auriculotherapy in, you want to treat your spouse, you whatever it is that you want to do, you have the resources that are available to you. And first, I think, is start with the app and then take it from there. And then go have fun. Auriculotherapy is fun. My grandkids can do it. My husband can do it for me. I can do it on friends. I can help create miracles for people in their life wherever they go, because I have this little resource that's available to me, and it's not hard. Anyone can do it. And just because it's not just for acupuncturists. I really believe that everyone should be utilizing auriculotherapy. How's that?
That's great stuff, Dr. Kimberly. Thank you. I was just looking through the questions over here and going, boy, we've got our work cut out for us here. There's a lot of
Okay, let's
questions.
do it.
So, all right. Now, I know there's a bunch in the Q&A, and we're going to get to those as well. Since there's so many in the chat, I'm gonna run through those real quick. And then
So is the link already in the description? Have we already put the link down for
yeah,
people?
the link is in the chat a couple of times.
Okay.
Not only for your downloaded handout, but people have asked about various tools. There's links there to everything you need. Some people were saying that link isn't for the handout. Yeah, it is. Scroll down. You'll see. Click to download the handout. So,
Okay.
okay, with that then, let's just start knocking some of these off. Somebody, let's see, Leslie says, do you have a protocol to reduce pressure in the eye for glaucoma?
So I believe there is a glaucoma protocol, but that's where you start digging and you start learning more. You can search for eye. First of all, you can search an eye and see how many protocols come up for eye, and you could start reading. There's information about each of the points within the protocols. If you're an acupuncturist, you might be thinking of liver, and you might even be thinking of blood pressure. It depends on what your level of knowledge is. It won't be a one for all for everything, every level. That's why the protocols were created, because it gives you a general idea. But if you search based on symptoms, that is what I recommend. I don't
Great.
recommend you not seeing your eye doctor. I do recommend
Of course,
that.
yeah. But in the Auriculo 360 app, there is a glaucoma protocol, and of course, the search feature is really powerful. Diana says 5-point needle. Must it be in both ears?
5-point needle?
Yeah, and I'm not sure. Is that referring to the NATA protocol? Or is that referring to, so you didn't have a 5-point protocol up?
My go-to, so my general answer for that is, again, if it's pain, treat the one side. If it's global, treat both sides.
Okay. All right. Next, age and time for treatments. Like, is it, different? Is it 15 seconds for a child, 5 seconds for a child? Is it different for adults?
Well, if you have a wiggly child, you're gonna treat less. My go-to answer is 10 to 15 seconds.
Right. Okay. How about treatment during pregnancy? Are there specific points that you would avoid during pregnancy, or specific points out of the 10 amazing points that you would avoid?
I don't think there's any reason to avoid the type of treatment that we're recommending here. I know that if you were in the first trimester, we don't put needles in ears, but I have zero problem with pressure points or laser. No problem.
Okay. Next, Janice says, what about Bell's palsy?
There is a protocol in Auriculo 360 for Bell's palsy. Bell's palsy is one of those difficult to treat conditions. So I think it can, if it's a difficult to treat condition, I think that the auriculo can help supplement treatment, but I wouldn't use auriculo as my only resource.
Excellent. And for, you know, I would just add that for many things, auricular is not going to be the only thing you'll want to do.
It's a great supplement.
It's a great supplement, and it's a great standalone treatment when it's all you've got available to you. And for many things, it is great standalone treatment, and that's all you need. But for some of these more complex conditions, you'll want to hit it with everything you have from all sides. Okay, Michelle says ear seeds provide longer term stimulation of a point. Oh, okay, that's not really a question. It's a fact. So thanks, Michelle. You're correct. Can you treat two different issues in one visit?
That's when I would take the 10 powerful points that I recommended, and I would just kind of treat global throughout the body. Literally, from my perspective as an acupuncturist, when I'm putting the body into balance, 80% of the symptoms can fall off the plate. And I see those 10 points that I shared with you as an opportunity for resetting the whole body. So yeah, can I have anxiety and be constipated and also have a headache? And if I use the basis protocol that I have taught you, whether it's the 3 or choosing from the 10, you can make global changes through the body because of the systems that you're treating.
Okay. Sunanda says, which points are most effective for emotions in general and depression in particular?
You know, I would go with my download, the vagus. That's where I would start, right there. I would start with the vagus nerve. You're changing emotions, you're changing inflammation.
Uh-oh, Dr. Kimberly, you there?
Boost mood. I would, it's such a good basic protocol.
Okay, and you froze up. I don't know if it was my connection or yours.
Am I here now?
Yeah, we're okay now. Maybe it was on my end. I apologize. Okay, Kim says, can you speak about those small round metal ear seeds? I've had experience where they start embedding into the skin. Talking about the pellets, the little gold pellets. What's your experience? Have you noticed that?
Well, they're supposed to be able to press into the skin in order to create the pressure. So if you're talking about semi-permanent where it's kind of like a staple gun going into the ear, that's not what I'm talking about, and that's not what I'm promoting in this webinar at all. I'm literally promoting the little gold pellets or the seeds or the laser. If I were going to treat a point on your face, my finger would push into it, right? Well, that's using a very small mechanism to create pressure on the point.
And I would add that I have seen those. If you leave them on for too long, don't leave them on for a week. I like to have them there for 2 or 3 days. But yeah, if they're on for an excessive length of time, they can start to get embedded in there. So don't do that. Okay. Let's see. Christine says, the hardest thing for me is finding ways to generate client interest. How can I find people to purchase therapies? I'm a mental health clinician, but I'm trying to spend less time in the therapy room after serious burnout.
Oh, I would totally take this resource that I have given you. And if you ask that person to regulate the vagus nerve within their body for 3 minutes a day, that's what this protocol talks about, because you're literally just pressing on the points 3 times a day, which is going to take you 3 minutes in your whole day. You're going to change so much in your nervous system, which is going to change emotions, and it's going to change everything else. It would be my hypothesis that you're going to get better results as a counselor if that patient can regulate these systems before they try to talk about the next issue. That's how I'm utilizing this in my clinic. Having my patients self-treat these 3 points from home in between their visits makes my job a whole lot easier.
Okay, next question. Is auriculotherapy contraindicated for people with pacemakers or heart arrhythmias?
I wouldn't use the electrical on the ear, but I would absolutely use the laser or the ear seeds.
Great.
Pellets.
Next, boy, here's a here's a heavy duty question. David says, what articles are there showing somatary sensory cortex presentation of some or most of these points? And have there been central nervous system changes showing where the treatment affected? Obviously, there are benefits and subjective improvements. In other words, brain studies, I think, is the
I
point.
think the way that you would do a search on that would be to go into the resource centers, and I would search for vagus nerve auriculotherapy, clinical studies related to auriculotherapy. There are a lot of them out there.
Yeah, and it's a growing topic on PubMed. There's every year it's the research increases. Um, okay, somebody said about the pellets, how does it work? Is it a kind of needle?
Nope, it's not a needle. In fact, and now we have these bling and little gold balls. In college, it was literally a vicarious seed, which we saw as a radish seed. So it was a seed that you would put on the ear and you would press on it. My joke was people would say, how long do you keep these in? And I said, well, for sure take them out if you're growing radishes out of your ears. But I think I forgot the original question.
Are
My
they,
story.
is it a kind of needle? And the
It's
answer is
not a needle. It's literally, it started out as a seed, and then there are some theories that will say using gold versus silver. And there are, then what we learned with electro is your device that if you have the Plano Select, it actually is going to find the different points. It's going to find negative and positive points and give the right frequencies to go with that. And there's training involved with the Plano Select that comes with it when it comes. But again, that's taking you to the better level where you can dig deeper.
okay. The next couple questions are about lasers, and I might just handle these. The first one is eye protection with laser. Is that needed? And the answer is on the types of lasers that we recommend that are sub 5 milliwatt, then generally no, eye protection is not required. Now, is eye protection always a good idea? Yes. Is it mandatory at this level of power? No, they're considered eye safe. But we do have nice laser protection glasses, and in an abundance of caution, we always recommend them. Next, somebody, let's see, where was that one? Oh yeah, when Lorna said when to use blue and green lasers. Um, I don't like green lasers at all. I just have not seen any good effects with them. Blue lasers we recommend on body points. Don't use them so much on the ears. I typically stick with red. What's your thought, Kimberly?
Red is easy. Red, in my opinion, red will regulate negative or positive. Uh, you would have no way, if you were just using laser, you'd have no way to figure out if things were negative or positive and how you needed to treat. Red, it's effective and it works.
Okay, Ian asked for the link to Points app. I will type that in here, but it's points-pc.com. Let's see. How long to use the laser on each point? I typically say about 15 seconds. Kimberly, what do you say?
10 to 15 seconds.
All righty. Good. Let's see. Love my red laser and Point O Select. Thanks, Kim. It never lies. Point O Select never lies. It will always tell you when a point needs treatment. Well, that's awesome. Thank you for that. Then let's see. Do you ever treat with the laser or Point O Select and then apply ear seeds for them to go home with? I'd say certainly.
Yes, absolutely. I will find the point with the Plano Select. I'll treat it. I will leave a little dent where I treated. Then I will add the ear seed and then send them home.
All righty. And here I'm putting that link in for points that I said
We've done a lot of training for acupuncturists for some of these deeper questions that are definitely more advanced. This webinar is for the purpose of an introductory level, and we wanted to empower everyone from an introductory level. So you can empower your patients if you are an acupuncturist as well.
Absolutely. Wow, boy, there are so many questions here. You really got a lot of interest here. So we gotta keep on trucking.
Okay, let's keep
Next.
going.
Okay. Let's see something about an AccuScope. The AccuScope, interesting tool. I didn't know they were still made, but that's an older electrical tool outside of what we're talking about today. Any correlation between complaints and symptoms and the physical visual inspection of the ear?
Yes, and that's more of an advanced therapy. That's I would call that more of an advanced therapy.
Okay. Next, as a massage therapist, Denise says, my clients love when I use microcurrent on ear points and then I put seeds on them, especially allergies or headaches. Oh, well, good. That wasn't a question. It was a comment. Thanks, Denise. Rachel agrees. All right. Aphasia due to ischemic stroke. So somebody has a stroke, lose the ability of speech.
That's a difficult condition. I mean, I can't say that I've been able to treat that just with auriculotherapy.
Can you use this to treat age-related macular degeneration?
Another really difficult condition.
But it certainly can be used as an adjunct to other things you're doing.
Absolutely.
Okay, Ian asks if there are specific points for fibromyalgia.
So let's talk about fibromyalgia just for a second, because I get people who say, can this treat fibromyalgia? I want to break, I'm a specialist in fibromyalgia. I've been treating fibromyalgia for years. You can't, there are points, and I honestly, I'm sure there's a protocol in Auriculo 360 for fibromyalgia. The 10 points that I gave you would be great for fibromyalgia. The vagus nerve stimulation protocol would be great for fibromyalgia. But then on the next level, what are the symptoms that you're feeling of fibromyalgia today? Do I have a headache? Do I have hip pain? Do I have digestive disorders? Do I have anxiety? You have to break down the symptoms that you have and then treat the symptoms accordingly. But this protocol would be a good daily. And my guess is if you did this protocol 3 times a day, daily, that you would have less symptoms of fibromyalgia that you have to then chase down. How's that?
Good. Good. Kathy said the direct link to the protocol download didn't work, at least on the Chromebook. If you go to the main link that we gave out, you can just scroll down and there's a link to download the protocol there. Everything's on that page. It's down in the description if you're watching a replay, or it's over in the comments if you're watching this live. Let's see, Diana clarified. She said, what I'm asking is it important to treat both ears for treatment? And you've kind of spoken to that a couple times, so hit it briefly.
I'll say it one more time. If you are in pain, treat the ear related to the pain. Left thumb pain, treat the left ear. If you have overall symptoms, you have anxiety, you have high blood pressure, you have acid reflux, you have hemorrhoids, you have whatever you're treating weight loss, you're going to treat globally, and I like to treat both sides.
Okay. David asked if you could briefly cover battlefield acupuncture on the auricular points. Honestly, that's covered. There's a full write-up right inside the app on Auriculo 360. And so unless there's something you want to say about it, Kimberly, I'm going to recommend people go there.
I think that's more of an advanced therapy. It's a great resource, but it's not for the beginners.
Okay, Ian asked if Point of Select is microcurrent. Yes, it is. John said the embedding pellets are totally different. I've had both. Good to know. Yes, I've seen some that tend to get embedded and some that really do a nice job not getting embedded. And I haven't seen a lot of problems with the ones that we carry. Mary asked, how did you move your shoulder after you do it for shoulder pain. So you're treating for shoulder pain, you're having them move the shoulder. How did you move it? Just
I don't know. I
motion.
just have them recreate the pain. First, I have them show me what happens when you have pain. They show me. I do the treatment, and then I say, okay, recreate that pain. And then they go, wait, it's in there somewhere because the pain is gone.
Lorna says X per day for how long? How many per day and how long, basically, is what Lorna's saying.
Are we talking about the vagus nerve treatment? Well, I'll
Doesn't
just assume
say.
it's the vagus nerve treatment. I would treat this, I would use this treatment 3 times a day, and it's 3 points, and I do 10 to 15 seconds per point. That's how I came up with my less than 3 minutes per day. If you're putting ear pellets on, if you're in pain, press on them as pain begins to come back, because you're literally opening up those pathways so that it doesn't have to become overwhelmed again. You're like, oh, I'm feeling that coming back. You treat, you self-treat, and then you move around and you keep going. Your body will tell you when to treat. If you're treating general conditions, I would say 3 times a day, remember to go up and press on those points.
Okay. Let's see. Marie says, how do you mirror the points on the back of the ear if they're points in the center here where you don't really have a back?
So let me clarify that. When I say treat the points on the back of the ear, it's related to the pain protocols, and those aren't in the inner ear. They're more on this area of your ear here. So the back of the ear, you're just mirroring on both sides. So most of the pain protocols are on the part of the ear that you can access both sides.
Okay, and Stein Ove says gold pellets are ionized and self-stimulating, so no need to put pressure on them like the seeds. And that's a great point. That's part of the reason you use the gold. So thanks for the reminder there. Claude says Shenmen is not as sensitive to pressure or electrical detection as point zero or to points that relate to the frontal lobe, which always I find reactive. Can you share any light on this? So Shenmen not being as active to pressure or electrical detection.
Shenmen and point zero, they don't have to be active to pressure or sensitization. Simply treating them will help whatever points on the ear need to come to the surface will bring them. You can treat them whether they're reactive or not.
Okay, Ian says, any protocols for Parkinson patients?
I don't know if there's a protocol in there for Parkinson's patients or not. Parkinson's, again, is one of those really difficult to treat conditions. I could help them with their anxiety. I can help them with their digestion. I could help them with the pain that they're experiencing. Think of not just Parkinson's, but think of the symptoms that the Parkinson's patient is experiencing. So my mother has Parkinson's, and so I can speak to this a little bit, but as she's progressing, her memory, her anxiety, the pain that she's feeling in relation to it. I'll just throw out there that in Chinese medicine, the liver is related to spasms in the body. So I would treat the liver also.
Okay. Let's see. Point of Select, is that online video training? Point of Select is actually a device. It comes with online video training. Hope that clarifies it. Courtney wants to know why the tools cost so much. Do they come with information, or is it just the tools? Actually, these are very heavily discounted. These are massive discounts from the regular prices. These are not kind of amateur, cheap plastic tools. These are all professional grade tools. And we've spent a lot of time and a lot of years developing them. So the different packages have different amounts of training and so on. And you can read through what the packages have. You can also buy tools a la carte, buy individual things if you're looking to save money and just want to get one or two things. Let's see. John Merrick shared a link about auriculotherapy. Thanks for that. Claude said, let me put it another way. Do you only treat points that are reactive to electrical detection or sensitive to pressure? In other words,
It
only
depends if
active
I'm
points.
working on good, better, and best. So if I'm working on best, if you're working on good, um, one of the tools and resources that you can utilize if you're treating, especially if you're treating pain, is there's an ear probe, and in the good kit, an ear probe comes with it, and you can use the ear probe to press along the area and find the areas that are the most painful, or you can just utilize what's in the app. If you're working on your best level, then utilizing the point of select, it's going to tell you the active points. So that's my recommendation.
Okay. Let's see. Shannon says there have been extensive clinical studies on the benefits of treating PTSD in veterans with auriculotherapy as well. Haven't spent time in the 360 app, but I know that a PTSD protocol was published through the study, and that's good to know. And we have a PTSD protocol in Auriculo 360 as well, which you can look at there. And of course, keep in mind that in the app, you can always make your own protocols. So if you see a great study, you see a great protocol, and you want to make sure that that's in the app, go in there and tap the points and add it. It's super easy, and then you've got it. Okay, there's a bunch more questions about specific conditions, and I'm concerned that we probably need to keep going and just invite people with specific questions about a specific condition to do a little research and look those up. We've got great tools. Look them up in Auriculo 360.
And remember that it's not, if you don't find a condition in Auriculo 360, it's because there aren't specific magic points that will completely change a condition. You literally can change the internal environment of the body based on this protocol that is in your downloads. The 10 points that I recommended are very good go-tos for multiple systems in the body. And then where you're going to get your best results with auriculotherapy is then to treat the symptom. As you're changing the internal environment in the body, then there will be less symptoms and you'll have less need for symptoms. So you have to think in the way of symptoms and full body overview.
Okay, Rachel says, how does laser with seeds work? Do you go laser first and then the seeds? And I'd say yes, absolutely.
And yeah, but we talked about good, better, and best. You can use laser as a standalone all by itself.
But if you're going to use it with seeds, laser first and then put the seed on the point, because
Yes,
otherwise the seed is in the way.
I tend to not do both. I use those as one or the other.
Okay, Shannon says, can you talk a little bit about ear pellet protocol schedules? Do you leave the ear seeds on for 3 days and then remove them for a week, or just remove them for a day and then put them on again? How long do you wait?
In your handout, I did address that, and I gave my recommendation in my clinic. I tell patients, apply the pellet to the points mentioned on both ears, give gentle pressure 3 times a day for about 10 to 15 seconds per pellet. After 5 to 7 days, remove the pellets and reapply if needed. So this method provides consistent stimulation throughout the day and is an easy, non-invasive way to treat the vagus nerve. So that's kind of the go-to of how I do things in my clinic.
Great, great. And there are a bunch more questions about specific conditions or people asking for specific protocols. And there's also folks that have jumped in with some great advice, but let's see, cancer, where, please, and to tonify or sedate. Well, that's, I think, well beyond a beginning course. And keep in mind, you're not treating cancer, but you can treat associated symptoms. Let's see. Oh, Daryl, thanks for the reminder. Daryl says, for everyone asking about specific conditions, there's a free trial on the software. Literally just download the software and look. And that's a great point, Daryl. Thank you. You're absolutely right. And if you don't yet have Auriculo 360, download it. You got a 30-day free trial. There's nothing to lose. And I think you're going to love it. So jump in on that. Plus, it's super affordable. It's not we really want to go wide and not deep, meaning we want
to. Can you imagine what it would be, what it's really worth? It's super affordable. Think of all of the books and all of the resources and all of the time and all of
over
the
a decade.
Hours. We have 15 years, you and I have worked together.
All right.
On Auriculo 360.
Let's see. Ian says point of select compared to using a laser. How does that compare? He wants to accelerate treatment and positive outcomes.
Well, good, better, best. If you're wanting to accelerate your outcomes, then I recommend the point of select, because you're going to be able to find the exact point and treat with the exact frequency needed. And so it just depends on the level that you want to expand to.
I'm laughing. Thank you for that. I'm laughing. I was reading ahead, and Daryl said Auriculo 360 is very underpriced. Let's not bring this up because Dr. Larson might figure it out.
I love Daryl.
Yeah, yeah. Thanks, Daryl.
Daryl's my friend.
Good to hear from you. Okay, let's see. Other questions. Do we ship to the UK? Yes. Have to go. Thanks for the great information. Ian purchased software. Great, Ian. Can I connect on my phone? Auriculo 360 runs on iPhones and Androids. Yep, you bet. Comparative anatomy for pets. Auricular on pets. Their ears are shaped differently, and so I don't really have
Oh, but you
experience.
can take that a
Mhm.
laser, maybe not when you're treating with patients, but what if that pet laid his head in your lap and you just literally took that laser and you scanned it all around and you gave him an ear rub? I bet that would work.
Yeah, and let's see. D. Davis says it's good to know you can use the laser without adding the ear seeds, but is there a better way to find the point before using the laser? Would you have to use a point of select? Well, electrical, like the point of select for locating, is always, in my opinion, the best way to locate specific active points. Laser is nice because it has a little bit broader area. So if you're in the general vicinity, you will get light into the point. Um, let's see. Diana says, I'm definitely getting this. Finally explained well. Thanks, Kimberly, for finally explaining it well. That's awesome.
Finally.
Finally. Thanks, Diana. Appreciate the comment. Now I'm jumping over to the Q and A's now. Ian asked about frozen shoulder. Have you done much
So
with
frozen
that?
shoulder is difficult to treat, and I mean, you can get some movement, but you're going to have to find out the mechanisms that are causing the frozen shoulder. I treat a lot of menopausal women, and it's based on hormones. So if you're going to be that expanded of a doctor, then you're going to understand that I'm treating the shoulder, but I'm also treating the hormones. So, or there could be scar tissue involved. There's a lot to frozen shoulder. So I don't have an exact answer, but I'm just teaching you how I think, and maybe that will guide you.
And I've seen good results for frozen shoulder, I'll add. Ian also asks, are points that are effective for osteoarthritis of the wrist and hand pain? The answer is obviously yes.
Yes, yes, yes. You
And hip
go into your app,
easy.
you do a search, you find the points.
Okay, Mary asked about extremely bad allergies to just about everything, giving very bad neurosymptoms such as imbalance, dizziness, also blacking out. And then she also asked about pituitary adenoma causing low hormones and bad brain fog. So lots of really difficult things there that need to be broken down by symptom and treated, I think.
And if you've got a lot of difficult conditions, I highly recommend you go find an acupuncturist who understands your condition, and then utilize auriculotherapy as an adjunct.
Good. Here's an interesting question. Nem asked, when you say laser, does the Gunalite count? And that's an interesting question because laser is very pinpoint for pinpoint points on the ear. Gunalite is a little broader and it has full spectrum light. I have not really done much auricular with the Gunalite because it's such a broad area. I tend to use that more for filling up the channels, filling up the collaterals. But what's your
Well,
experience, Kimberly?
you know, I do a lot of experimentation with the Guna light, and clearly our first explanation was GB20 at the top of the head, and we knew that it shifted polarities left and right side. I use Guna light at the bottom of the feet, at kidney 1 on the feet. I feel like it's very grounding, and if I'm doing the top of the head and I'm doing the bottom, I feel like it fills in between. But so I have been experimenting a little with the ear, not treating the ear points, but treating the ear canal with the Guna light. And because it's broad spectrum and that's an orifice that gets into the body, I think it could be a mechanism for tinnitus, brain fog, some of the long haulers conditions that we're treating. But
Excellent. Excellent. Wow. And I should tell you, Kimberly, there's a lot of people expressing gratitude, calling you a blessing, saying how wonderful they're finally getting it. They thought you did a great job teaching. Anyway, I just wanted to pass all that along to you. I know we're well past our time. Somebody else said, by the way, don't forget for very difficult conditions, use AccuGraph plus Point of Select. Thanks for that reminder. We've got a lot of great tools, even outside the realm of auriculotherapy. We've got a lot of great stuff, but we wanted to kind of focus today. Hey, Daryl, thanks. Mary, thanks. All the people that are giving some love there. We appreciate you all. Anything else before we close, Kimberly?
no, I just recommend this is a resource that you can take with you wherever you go. You need a little bit of knowledge to be good, but just keep expanding up on it and allow it to grow. Don't ever get stuck where you don't have any resources. Don't ever get locked into a house where you can't go outside and you have no resources. I really feel like auricular therapy, it's not the cure all. If you need a doctor, you need a doctor, right? It's not going to, if you have major conditions, it's not the cure all, but it is absolutely a very viable change to the systems within the body. And you could be somebody's hero.
Awesome. Awesome. Thanks so much. Last thing I'll add in is people are still asking, hey, what are the links? What are the links? How do I get the stuff? The link is in the chat. And if you're watching a replay, the link is in the description. That'll take you to a page where you can link to everything else. Tools, the handout, the replay, everything will be there on that page. So if you don't see it right away, just scroll down and find what you need.
Get your handout. Make sure that you begin utilizing this vagus nerve transformation. And if you are an acupuncturist, start having your patients use this. I'll create a package for my patients with ear seeds to make it super simple, but most of my patients want to have a laser. And so I sell them the laser so that they can self-treat from home. And just think of the marketing that you could do just by expanding your scope, empowering your patients, and having them see you as as a blessing and a leader. They'll come back.
Amen. All right, Dr. Kimberly, thank you. Thank you so much. Real pleasure as always. Thank you, everybody who attended. We will see you next time. Take care now. Bye-bye.
Bye.